High blood pressure is not just a number on a chart. It's a silent killer. And it could be quietly destroying your body right now while you feel perfectly well. No headaches, no chest pain, no nosebleeds, no symptoms. And then one day, bam, a heart attack, a stroke, kidney failure, or worse, hit you unexpectedly. I've seen it happen to too many people who thought, hey, I feel fine, I'll deal with it later. Later never came. But it doesn't have to be you. That's why this video matters. I'm going to show you the top 7 dangers of high blood pressure that most people overlook and how you can stop them before it's too late. Here's a quick question. When was the last time you checked your blood pressure? Let me know in the comments below. I'm eager to hear from you. And stick around, this could be the video that saves your life. Hello friends, I'm Dr. T, board-certified in cardiology and lifestyle medicine. Let's dive into it. Number 7, let's talk about a topic nobody wants to admit, but it matters. High blood pressure damages the small blood vessels that supply your reproductive organs. In men, this often leads to erectile dysfunction, which could be an early warning sign of a vascular disease. Why? Because size matters. The penile artery is 1 to 2 millimeters wide, compared to the coronary arteries, the pipes that supply blood to your heart, that are 3 to 4 millimeters wide. And the carotid arteries that goes from your heart to your brain through your neck are 5 to 6 millimeters wide. So the plaque in the penile artery will cause trouble with blood flow years before your heart arteries will do it to your heart. Erectile dysfunction is the canary in the coal mine. In women, it can reduce blood flow to the vagina and clitoris, decreasing arousal and satisfaction and causing even pain during intercourse. If you've noticed changes, it might not just be age. It could be your blood pressure speaking up. And here's the thing, fixing the blood pressure often improves these symptoms. Your eyes has some of the smallest, most delicate blood vessels in your body. When your blood pressure is too high, these vessels can thicken, narrow, or even burst, leading to a condition called hypertensive retinopathy. What it means is the damage that high blood pressure causes in the back of your eyes, in your retina. And it can cause blurred vision, spots, and even in some cases blindness. And what's worse, you might not notice until serious damage is done. An eye exam can often spot high blood pressure damage before you have symptoms. Damage to your lower extremities. High blood pressure also affects the arteries going to your legs and your feet. It narrows arteries, reducing blood flow to your lower extremity. This condition is called peripheral artery disease. Symptoms include pain while walking in your calves, in your thighs, could cause numbness, cold feet, and slow healing sores. And left unchecked, it can lead to severe infection or even amputation. If you notice leg pain or cold feet, don't blame it just on aging. It could be a warning sign from your arteries. High blood pressure or hypertension is often called the silent killer because it quietly damages your blood vessels over time. One of the most dangerous complications it can cause is the aneurysm. Aneurysm is a bulging in a section of artery wall. Think of it like a weak spot on a garden hose. As the pressure inside increases, that weak spot is going to stretch, is going to bulge. And if it bursts, it can cause life-threatening bleeding. And aneurysms can develop in various parts of your body, but they are especially dangerous when they occur in your brain. It's called a cerebral aneurysm. Or in the larger artery in your body, the aorta, that brings blood from your heart to the rest of your body. It's called the aortic aneurysm. Both can rupture suddenly without warning, often with fatal consequences. And the scary part, most aneurysms don't cause any symptoms until it's too late, which is why keeping your blood pressure under control is one of the smartest moves you can make for your long-term health. And regrettably, I had a case on my family. One of my cousins, while at work, collapsed, and he was in his late 20s, and autopsy showed that he had a cerebral aneurysm that burst, and there was nothing that could be done. He didn't make it. Number 3, damage to the kidneys. Your kidneys are like your water filter. They filter about 50 gallons of blood a day. And high blood pressure leads to scarring in the tissues and weakens the tiny vessels inside them, reducing their ability to filter waste. They will cause fluid retention. You're going to have swelling in your feet, in your legs. It could lead to chronic kidney disease. And even in severe cases, you end up in dialysis. And you might wonder what actually causes kidneys to fail in the first place. Well, the top 3 culprits are pretty clear. The number 1 is diabetes. High blood sugar over time damages those tiny filters inside your kidneys. And number 2 is high blood pressure. It scars and weakens the delicate blood vessels, just like it does in the heart and the brain. And number 3 is inflammation in the kidneys called glomerular nephritis. We're not going to go into it at this point. But the good news is hypertension is a leading cause of kidney failure, but is highly treatable and preventable. And high blood pressure is often called the silent killer, but it's not always silent. And to avoid complications of high blood pressure, watch this video, Top 7 High Blood Pressure Symptoms You Should Never Ignore. I'll put the link above and on the description below. Let's talk about damage to your brain. Your brain depends on steady, healthy blood flow, and high blood pressure makes arteries in the brain stiff and narrow, increasing the risk of mini strokes, transient ischemic attacks, or a full-blown stroke, and even vascular dementia. Vascular dementia is a memory loss caused by poor blood flow to the brain, poor circulation, and high blood pressure is one of the biggest culprits. If you're having trouble remembering names or misplacing things often, don't just chalk it out to old age. Get that blood pressure checked. And number 1, silent risk of high blood pressure, damage to your heart. The hardest working muscle in your body is your heart. Think about it. The heart beats between 60 and 100 times a minute, about 100,000 times a day. It never stops. When it stops, you're gone. So high blood pressure affects the heart in 2 main ways. Number 1, makes your heart working much harder. Imagine like the heart lifting a weight. If you have high blood pressure, it's a bigger weight that the heart has to lift. And over time, this will lead to a thickening of the left ventricle, the main pumping chamber on the heart, and will compensate. If the high blood pressure continues, this will lead to a weakening heart muscle and essentially leading to a congestive heart failure and even dangerous arrhythmias and increasing your risk for sudden cardiac death. In addition, high blood pressure will damage the plaques, the coronary arteries that supply blood to your heart. And if they get blocked, damage, you may have angina or unstable angina or lead to a heart attack. Don't be a victim. Know your numbers. Blood pressure is one of the most controllable risk factors out there. And here's the best part. You can often lower your high blood pressure naturally without pills. To learn more, watch this video, Top 7 Foods to Lower Your Blood Pressure Naturally Without Medication. I'll put a link above and on the description below. And remember, your health, the most precious asset. Take control. See you next video.